Mateen, he's unbelievable in the Hijama treatment which we currently started doing here. And I invited Mateen over just to come and have a look, and if it was something, you know, we could work together on, just on the healing aspects, because he works more on the internal aspects with the blood, and I work with the external aspects with the posture and everything that corresponds and complements one another. So I thought it was a brilliant treatment to have here, but I've invited Mateen over just to give a brief overview on cupping. So we're going to talk about basically the brief history of it, the components that sort of, you know, how cupping is executed, and then also the benefits of cupping as well. So this is why I brought the main man, the mighty warrior, in today, and invited him over just to give sort of a brief background into cupping and its healing benefits, and then I'll show you my own story in terms of how I got into it as well. And it's a treatment I massively believe in, and I think honestly everyone can benefit from it. If you've never had it, definitely get booked in and get it sorted, but we're going to give you a brief overview in how all this works. So Mateen, basically in terms of the history first, because a lot of people, this is, I mean, it looks worse than what it actually is. Yeah. You know, during, everyone would tell you that, you know, yeah. Oh my God, it's this, but the treatment itself it's not harsh, and it's not. It's to be honest, my massages are probably worse, more painful than what they actually go through in cupping. Yeah. And most people would confirm that, especially the ones that had it done last Saturday as well. But the brief history routine in terms of cupping, where did this all start?
Okay, so in terms of history on cupping, it kind of differs between all of the different parts of the world, because you've got the Greeks, and then you've got the Turkish, the Arabs, and then you've got Chinese. Now, Chinese have been practicing this for about 3,000 years, but the historians mention also that it's been practiced probably 5,000 to 6,000 years before that. Now, within the countries they differ with one another. We started it first, or you started it first, but east and west of it all, they all practice it, and they all do their own different techniques. Right. So you've got the Chinese, which mainly use the fire cupping. And then you've got the Arabs, or the Turkish as well, who use the horns. Now you've also got the bamboo sticks as well. Right. Back in them days, the instruments were different. The instruments were slightly different to what we use now. I mean, so if I go upon the instruments, you've got, them days used to also use certain type of bones as well, for them to do cupping. The bamboo sticks, like I mentioned, some parts of certain type of metal they used to use as well. So all of them have got different methods, but now what you've got is that you've got the plastic cups, and we've got the suctions that we create from upon these cups itself. Now, in that time, we don't know what the hygiene level it was like, but now we've got such a good standard that we've got the healthcare itself, that they want everything to be cleansed properly. So this is why I prefer now, I would say, that is these plastic cups. Right. Which are used, like, for example, if I used it on you, straight away it goes straight into the disposable company, get rid of it, burn it. But I wouldn't want to go down the route of horns now, or wouldn't want to go down as using certain instruments that blood has been let into.
Of course, because of the hygiene and the infection control and everything like that, which is brilliant, and it's advanced. Massively, which obviously people need to understand. It is sort of hygiene, and there are people who still practice it who unhygienically as well, don't they? You know what I mean? And this was the beautiful thing with you, is assessing you when I brought Alan as well, someone with high cholesterol and high blood pressure, but we'll talk about the benefits in a minute. But ultimately watching you and how sort of different from the experiences I've had with some people as well, is you don't really think, because I didn't know much about the treatment in general anyway, but you don't really think about hygiene or infection control or anything like that. I know a lot of people would, but me personally, and you see a lot of people who are into Hijama and wet cupping, or fire cupping and such, the benefit in the treatment is more focused on than the actual, but most people don't highlight how important the infection control, the hygiene is, and that was the beautiful thing about you, is because everything is covered, every blade is different to every single individual. The disposable bins, the clinical bins that you use as well, and also you've got to pay for, which are quite expensive as well. Everything is above board, and that was the amazing thing with you, and that was the reason why, you know, I highly recommended a lot of my people to you as well. But it's because of the way you do the treatment itself. I think it's above anyone else I've ever experienced with anyway, to be honest. The benefits, let's talk about the procedure, because you talk about fire cupping, you talk about dry cupping, you talk about wet cupping, and there's all these different types of cupping. Just give a brief overview in terms of like what dry cupping is, what fire cupping is, and what wet cupping is, and how they sort of differ slightly as well.
So you've got the fire cupping. Let's start with fire cupping. The fire cupping itself is good for example, if someone's got pain in the back. So if they've got pain in the back, they'll use fire cupping to kind of break down any elements that are like any scar tissues or anything like that, or inflammation in that area. But also with the fire cupping, you will find that the toxins will come up to the surface of the skin, but they don't do the cuts to actually release those toxins, for it to actually for the fresh blood to actually sit upon those areas that it's just being cupped upon, so that it can heal that area. Now the wet cupping actually is the best form, because then you're not actually, with fire cupping, you're not actually spreading those you're not spreading the toxins around the body, so that it can come out from your excretion or from your urine or anything. But with that, I find it that it can be slightly a problem for the person as well. So that if the toxins are coming out from the urine area, so you'll have certain particles that are still going to be left upon the bladder, and those are particles of toxins. You don't want them on your bladder. It's going to cause some other infections or problems. Now with the wet cupping, what you're doing is basically you're applying the cups upon that area. You're bringing the cups, you're bringing the toxin to the top surface of the skin, and basically releasing those toxins into the cup, and you get rid of them. And that way, in that area of cups, in that area of where you just had the cupping done, the fresh blood will sit on it nice and comfortably. Anything that needs to be healed properly, it will heal it properly as well.
Amazing. Okay, so you definitely recommend the wet cupping then above anything, especially for people who are massively into dry cupping as well. Just explain a bit about dry cupping then.
Okay, so dry cupping is good for initially it's good for people who can't have wet cupping, because not everyone can have wet cupping. For example, like you got certain you got to definitely go through like a certain kind of criteria with your assessment of the person who you're going to do cupping on. For example, like you might have a person who's got diabetes, and he's got high blood pressure. He might have a heart attack in the last few years, or maybe within that time. So depending on what medication they're on as well, you've got to look at all the aspects of that. And with them type of clients, then you will have to do dry cupping. Now, with again doing dry cupping, spreading the toxins out, yes, the only thing is you would have to advise them is that to have certain things to detox their bladder area as well, by giving them good, right format of drinks, or giving them the right format of sort of treatment and advice.
Sort of nutrition.
Nutrition is very important to this.
Of course, it's huge.
Even to all the aspects, whether it's wet cupping, dry cupping, any type of cupping, nutrition is most important.
And also the balance of, because obviously we noticed, it was a massive eye-opener for me. I know you see it every day, but even the ones who had great nutrition, but they didn't have the balance with life in terms of rest and movement.
Of course.
So people who are constantly moving, they don't rest. Just the stress and the jelly that was on their body as well, and you think, God, this is actually creating blockages more than anything, which we'll get into, and this was the reasons how I got into it as well.
You see, what it is, Seb, is that you got guys who are, or even women that are into training. The people especially that are into training, like you said, they're not giving their body enough rest.
No, they don't.
If they're not going to give their body some rest, they're going to they're gonna get other acids and stuff like that building up
lactic
inside.
acid builds up, uric acid builds up.
The uric acid is the worst one.
Yeah, right.
Okay, we know that obviously lactic acid, when that builds up through training, what is it, about 90 seconds after that, it just drops down.
Yeah.
But then
different in different people, but mostly,
But your rest of your muscles is most important as well, giving them good care as well.
Right.
So.
No, it's fascinating. But with the do you know the blood flow? That obviously with some of the people that we witnessed, and obviously just going through the consultation forms that we went with them, and some of them found it very difficult to rest as well. But their nutrition was brilliant, wasn't it? So we've got to complement cupping. We've got to make people understand. Listen, the cupping itself, the treatment is absolutely incredible, which we'll get onto in a minute. But if you're having a lifestyle which consists of alcohol, stimulants, processed foods, genetically modified foods, a lifestyle of stress, anxiety, and not resting enough, and not giving the brain or body rest, not sleeping enough, the body isn't able to recover. This all then hinders healing, doesn't it, for the individual? So we're trying to educate people, look, we've got to get a complement of absolutely everything.
Of course.
So this is a whole, holistic, let's call it, solution to people to find back balance. And ultimately that's the whole idea. See what their insides are like, and we can only judge that predominantly from what the blood, and we've witnessed that as well. I mean, Justin surprised me the most, because bear in mind, this guy, but it just showed, just mentally, just how much of a balance he has. He only trains twice a week, let's say, and he's a busy guy, but he's got a great, he sleeps well, his nutrition isn't terrible, as you could tell, doesn't drink loads of alcohol, not a massive stimulant drinker, not food colourings, preservatives, none of that sort of stuff, and caffeine intake. And a lot of people's diet also consists of toxic substances, which this then runs through the blood, and we can clearly see it.
You see, like, a lot of people don't understand why or how toxins can also be built up. What you eat and what you breathe. So obviously the air that we breathe as well, from the pollution and everything like that, you can actually get toxins as well. But in terms of when you was talking about the blood, you saw it yourself, and you was shocked in how you saw that, how the blood was coming out, even to the most healthiest of a bodybuilder or a professional in their nutrition.
Well then healthiest of bodybuilders, that we associate bodybuilding because of image. I mean, these guys look incredible. Some of them, they look incredible. But deep down, though, Martin, they're not actually the healthiest of people. No. Because when you analyse it, especially for me, like last Saturday, I'm fascinated with this Saturday because there's quite a few guys who are training.
There's a few guys who are training.
And these are guys that are massively into training. So it'll be fascinating to see what runs through with their system as well, which will be incredible. But also to outline the fact that image is only one part. Does that make sense? We've got to actually truly think about health from now on. But no, this was one of the reasons why I got into it. How I found out about cupping was I had a client who was a doctor from Scandinavia. And he told me about cupping. And he said it's one of the most incredible treatments, especially for men and women who are also in a state of imbalance. So psychological imbalance, depression, anxiety was one of the biggest, but I explained what he meant by that. But also he said, to prevent heart attacks and strokes, it is one of the best treatments you could ever have. And he went on to say, he says, anti-cholesterol medication and high blood pressure medication is not going to prevent you from heart attacks and strokes, because the side effects to this stuff, and also taking combination drugs, have their own side effects. Does that make sense? So what he was saying was, how this works is, people who are in a state of high cholesterol, let's say, cholesterol isn't a bad thing. He says they measure it in three ways. They measure, there's more ways, he says, they can break it down into ratios, but we have what's called HDL, high density lipoprotein, and we have LDL, which is low density lipoprotein. The HDL is the good cholesterol. So we remind ourselves, how do we know it's good cholesterol? The H standing for happy. Happy cholesterol. And the low density lipoprotein, which is the bad cholesterol. So we understand that. And how they measure it is they give you a total number, and basing it on that total number, they say you've now got high cholesterol.
Right.
But the problem is say, for example, mine and yours is 300, let's say, and you look at the number, you think, God, 300 is a high number. What happens though, if your HDL is 95, what happens, that takes it on a ratio of 3.2 to 3.3, so it's a 3.1, let's say, ratio.
Yeah.
That's not bad, because 5.1 is where the danger lies. But you look at the number 300 and you think, but we can also break this down anyway even further now if we ask for it to get broken down into even more specific ratios, which but predominantly they only have. Now, what happens is, mostly, if you study the people who statistically through science who have been discovered, who don't suffer any heart attacks and strokes, they're premenopausal women. The reason for that is because they have bleeding periods.
Yeah.
The men have no bleeding periods. So we have no way of releasing blood. And this was one of the reasons when you look statistically, women are always on a 0.5 scale less than men on cholesterol levels.
Yeah.
But also, the most fascinating thing with nature, and this was incredible, was he said the reason why the woman is because the uterus has two purposes. It has two purposes. Number one, it's there to support a newborn, and number two, it's to release blood. They're the only functions. They work hand in hand, and this is how incredible nature is. Because the reason why the woman will never, providing they don't smoke heavy or they don't take birth control pills, because birth control is one of the side effects is heart attacks and strokes, which is horrendous, isn't it? But then how many people do you know that are on birth control pills?
Of course.
It's incredible, but they're one of the side effects. But ultimately, what it came down to was, if we know women who are premenopausal don't suffer heart attacks and strokes, then we know also nature or God or higher power, whatever people believe in, it works incredible because it allows the newborn to become old enough to look after itself before the mother passes away. Now, not everyone obviously has that, but ultimately the idea behind nature and this isn't coming from me, this is coming from doctors, and then he says this is where he got educated, was from a book called Origins of Atherosclerosis, and it was written by two doctors, Dr. Ken Kenzie and Dr. Young Chow, and I've read that book because he's told me, and they explain about this, and it's incredible. And ultimately what he says, in the actual statistics, what was happening, the science research was in the 1990s, not even that long ago, they studied men over 8 years, so it was people over 8 years, I can't remember if it was men or women, but it was people over 8 years, and what they did, the fascinating thing was they followed them for 8 years, and these people only gave blood.
Right, okay.
So they didn't have the cup, they gave blood. Yeah. It reduced their heart attacks and strokes by 75 to 80%. Then in Scandinavia, they now use this as allopathic medicine.
Yeah, they do.
They now use this company as allopathic medicine. But the problem is in Scandinavia, there's a Scandinavia study which they tested them over a longer period. I can't remember the year, but they did it over a longer period. And that reduced it by 75 to 80%. So if we're not releasing blood and we understand what cholesterol is atherosclerosis when we get thickened or hardened arteries. So if we understand thickened and hardened arteries in men, cholesterol is then released because the HDL is high density lipoprotein. It's the protein that releases cholesterol. So cholesterol is actually a good thing because it's combating inflammation, but it's cholesterol released with plaque.
Yeah.
And that creates a covering for the inflammation. So the cause ultimately is, if we reduce the inflammation, what happens? We now get better health, better blood flow. And this was one of the biggest things I wanted to get going, and this was the reason why I then took him. I've been doing this now for over 6 years myself, and I wouldn't ever recommend it for anyone else if I didn't do it myself. And it's an unbelievable treatment, and I highly recommend any of you, especially men as well, because our blood just gets thicker and thicker and thicker. The arteries get hardened and hardened because of the cholesterol release, but we've got to look at deeper. Listen, what do you think is going to happen to anti-cholesterol medication and high blood pressure tablets? They're going to be non-existent. Okay, but just bear this in mind. This isn't coming from me. This is actually coming from doctors. So, you know, I don't want, you know, anyone thinking this is all mine. It's not. If you want to get the book, Origins of Atherosclerosis, read it yourself. To all the biomedical scientists, the doctors themselves, if you want to understand cholesterol and the hardening of arteries, get that book and it will really, really educate you, and we can prevent this from happening. We don't have to be giving out anti-cholesterol medication because it doesn't prevent heart attacks and strokes. The cause of it is cardiovascular inflammation. And we've got to understand what's causing it. Now, if we reduce the inflammation, and how cupping works, which is incredible, releases not only the toxins, but where there's inflammation in an area, what happens is when you get a sprained ankle, you get inflammation to the area, the muscles start tightening up, it creates a lot of tension, now you get pain. So, but if we release the blood from that area and the tension, now you get relief. But ultimately, we've got to look at it from a health point of view, and we've got to clean out the system internally. Remember, it's a complementing of different factors, you know, the emotional aspects, we've got the nutritional aspects, we've got the physical aspects, training, overtraining creates problems, and then obviously we've got other therapies and treatments like cupping, which massively complement your health. So definitely look into it, do your own work. Mateen's got a web page, Facebook. Go and check it out. He's put a lot of different stuff on there. I myself have got one. If you go to sebsaid.com, I've put a whole article by Dr. David Parker, who explains it when he takes it through a dark field microscope and a light field microscope, and he actually magnifies the cells from like 1,000 times, which he looks deep into the cells. And when he studied the blood from cupping, there were, you know, toxic metals coming from there. There were parasitic parasites. You had viruses. A major broad of illnesses that are caused, but we're eliminating this from the system, and it's unbelievable therapy. I massively believe in it, but honestly, definitely go and check it out. If there are anything else you want us to cover in regards to pain, definitely drop us an email. I know Ruth dropped an email. I've done one on anxiety, that will be going up soon as well. But in regards to cupping, the best therapy, especially for men. So if you are watching this video, even if you've never had it done, there's nothing to fear. If you've got any questions, just email us, message us, and we'll always reply back to you anyway. Or if there's anything you want us to cover that we haven't covered in the video about cupping, you want to know, honestly, just feel free to message both of us and we'll be happy to reply back. But Mateen, absolutely pleasure, man. I just wanted that to be out there because a lot of people have so many misconceptions.
Of course,
but no, really appreciate it, man.
Thank you very much.
I appreciate it.
Thank you.